So thank you. So as Lucy said, I'm Alix, the Macmillan Cancer Information and Support Manager, and Lucy Brooks and I are going to be presenting to you today on behalf of our Living With and Beyond cancer team. We're a very small team based in the oncology outpatients, which includes Lucy and myself, Daphne Birmingham, who's our Macmillan support worker, and Jane Makins, our data coordinator. And we also include a small complementary therapy team and a welfare and benefits advisor. And for the purpose of today, we're going to share with you how we improved access to our health and wellbeing session, which is called Empower, in the last year. So just a bit of background to personalised cancer care. So currently we have 3 million people living in the UK with a cancer diagnosis. And by 2030, this is predicted to rise to about 4 million people. With ever-evolving technologies and treatments, this has led to people living longer but needing to manage the consequences of treatment. And receiving care that's tailored to a person's needs can have a significant impact on their experience and their quality of life. So the NHS long-term plan for cancer states that where appropriate, every person diagnosed with cancer will have access to personalised care, including needs assessments, a care plan, and health and wellbeing information and support. And our Empower session sits within that health and wellbeing information and support. So what's Empower? Empower is a health and wellbeing session offered to patients early in their diagnosis. We developed it about three and a half years ago after feedback from patients who attended our well-established post-treatment event, which we used to hold pre-COVID at the YMCA once a quarter. And patients would say that the information they received was fantastic, really useful, but they wish they'd had it early on in their treatment. So we devised Empower. We held it weekly within the Cedar Centre. We had a group room in the Cedar Centre, and it was a 2.5-hour one-off session for patients and a family member or friend. And they were given a presentation and at the end of the session, an Empower booklet to take home. And within Empower, we covered these subjects, which was eating well, managing side effects, physical activity, overview of treatment, wellbeing and welfare, emotional impact, and what resources we have at BHRUT. And as you can see, we love an acronym, and that spells Empower quite nicely. So what did we do pre-COVID? As I said, we had a face-to-face group once a week, and we were starting to see an increase in attendance. So much so that sort of February time of last year, we were thinking about maybe putting on a second session a week. There was difficulty to have advocacy translating in a group setting. As you can imagine, we couldn't really have a translator there to translate. And it was also difficult to access for patients on a rapid pathway because it was another 2.5-hour session. It was another hospital appointment for people to fit into a very quick pathway. And only those who attended got the booklet with the information. And so we were having a maximum of 12 patients a week out of a possible 65 new diagnoses per week. So we were seeing a good percentage, but not everybody was getting this information. So as we know, in March of last year, we were all struck with going into lockdown, and we were suddenly unable to offer these group sessions. So we had to quickly think about how we could offer this virtually, which was a new experience for us and a new experience for patients too. So we used the presentation that we gave at the face-to-face groups, and we filmed this. So there are myself, Lucy, and 3 of our clinical nurse specialists helped us with filming the session. We engaged with all the clinical nurse specialists who are the patient's main contact and initial contact at diagnosis, and developed a new introductory letter which outlined Empower and included a QR code which patients can scan to access the film, which sits on the Trust website and the Trust YouTube channel. It was also available via a link for those people who couldn't scan, and we also have a DVD for those people who can't access it online. We asked that the CNSs gave all new patients the letter plus a copy of the Empower booklet. And the letter also invited patients to an MS Teams meeting with us to ask any further questions and to meet, albeit virtually, with other patients. We felt that this was a very important part of it because we know that what patients have been lacking in the last year is that peer-to-peer support. They've not been able to sit next to each other in a waiting room. They're not really able to sit next to each other in the chemotherapy suite. And certainly what we found with our group work, our group session, was the peer-to-peer support that patients and relatives got from each other. We know, because we've tracked it, that we have been able to reach many more patients in this last year by offering Empower This Way. Now, every new patient is given the information to read and to watch the film, rather than just those who chose to come to a group session in the past. They can access the film anytime at home. So if they're awake at 2 o'clock in the morning, they can watch us if they wish, and rewatch it as well, and send it to their friends and families to watch. And the information can be translated into different languages as it sits on YouTube, and they can change the subtitles to whichever language they prefer to have. In order to work on this project, we brought together a multidisciplinary team, which included Lucy and myself, and Jane, our data coordinator, who was an invaluable member of the team. I don't think we would have managed it without Jane collecting all the data. We worked with our fantastic medical photography team, especially Debs and Nigel, using their skills and expertise. And we had a very, we felt like weather girls. We had to stand in front of a green screen and be filmed doing our session. Our patient experience team helped us. Sandra Booth Martin helped us with developing our patient feedback forms. And Mark Chapman in comms helped us, giving us advice on using the Trust YouTube and website and translating into different languages. And last, but by no means least, was our patient partners. We work really closely with our patient partners. We're very lucky within Cancer Services that we've got Jackie O'Brien as our patient partner, and we have a very enthusiastic patient involvement group called CPAG. You're going to hear from Jackie shortly. Unfortunately, she couldn't be with us today, but she has filmed a presentation, which I'm going to share with you in a minute. She was an integral part of our working party and would meet regularly with us, which was a benefit of MS Teams because we could meet without having to travel to the hospital. But we also worked with 3 of our other patient partners, Sarah Turl, Noel Judge, and Jackie O'Brien. And over a period of 3 months, they rang patients for us who we knew had been given Empower with a list of feedback questions. We asked them to do that because we felt that we would get a more honest and rich conversation from patients than from healthcare professionals would have done. And in fact, they did. I'm just going to try and get Jackie's video to work now. You may need to up your volume. We've tried it before and the volume is quite low. So we'll see if this works.
No sound, Alix.
Yeah, none at all.
Okay. So I think what we'll do then, Katie, is that all right if we send it on with the presentation?
Yes, we'll circulate it. It'll be on our Twitter by the end of the day, I'm sure.
So it was just Jackie telling about her experience about working with us, and she's got some top tips. So I think that would be really useful to share from a patient partner point of view.
If you want to try, sorry to interrupt, just whenever you've got the option to share screen or share content. If you click on that, then at the top you've got include computer sound.
Yes, I think I had.
Oh, okay.
Let me just try it again.
All right.
Yeah, no, it's all right. I'll try it again, see if that works. I thought I had pressed it.
In the Kaizen Promotion Office team, we call this a PDSA, where you have another go, try it a different way and see if it works.
Alix, Jane, and other patient partners to enhance patient experience.
That works. Yeah, if you'd like to just take it back to the beginning, that'd be great. Thanks, Keith.
Hello, my name is Jackie O'Brien, and I've been a patient partner for 7 years with BHRUT in cancer and clinical support. As I'm passionate about excellent patient care, it has been a joy to work in partnership with Lucy, Alix, Jane and other patient partners to enhance patient experience. For me, one of the greatest strengths of this project is that the contribution patient partners can bring has been recognised from the outset. I've been involved by Lucy and Alix from the very beginning of the initial design, and I felt listened to and valued and have witnessed mine and other patient partner ideas being incorporated where appropriate as we move forward, which to me is true patient partnership. As patient views are crucial in ensuring that services meet the needs of diverse communities, we developed a survey to gather feedback on patients' experience of being introduced to Empower, which helped shape the progress of this project. As a group, we felt that the survey could most usefully be conducted by myself and 3 other patient partners, Sarah, Jackie and Noel. The rationale for this was that patients may feel more comfortable in talking to patient partners, as there is likely to be a different level of relationship with their clinical teams. And over a 3-month period, we would each telephone a group of patients using the questionnaire and feedback the results to Lucy, Alix and Jane. For me, this is where I would like to share a top tip. We see our project as a work in progress, and we have accommodated the need to be flexible and fluid in line with the feedback that has been gathered from patients. This is actually vital, as one size does not fit all, and it is important to be responsive to the diverse needs of patients and also the surrounding context at any given time, for example, the pandemic. I will leave you with an old Chinese proverb, and that is that change can equal anxiety, but it can also equal opportunity. And as you move forward, you will experience the challenges, but also the creativity and the satisfaction and ultimately the feedback from patients, acknowledging their enhanced experience of care. I'll now pass you back to Lucy. Thank you.
So thank you, Jackie. So now just to get into the nitty-gritty bits about the data. So we monitored this really closely, and we couldn't have done this without Jane Makin, our data administrator. So we tracked very closely the numbers of patients that were now getting this information. And this graph just shows us that the green line are the numbers of patients who on a weekly basis were actually attending and getting the information when we were doing this face-to-face. And the blue line is the numbers that we're now getting this information on a weekly basis now that we do it in a virtual manner. So it clearly shows the large increase in patients accessing this information. Next slide, please.
I've moved it on, Lucy.
Thank you. And this work, we started this work anyway, but we then got the opportunity to join in NHS England Cancer Improvement Collaborative, which we joined in September. And this actually really helped us work through this process of implementing the change. It was a great opportunity for learning and sharing from other trusts. We found trusts that were trying to work on some fairly similar projects that we could buddy up with and work with and share ideas. It also provided us with improvement tools similar to Pride Way, which helped us to support our change and work through that process. And really, ultimately, it focused us on the importance of co-production and a collaborative approach with people with lived experience. So the importance of engaging our patients and our patient partners in any changes that we make. Next slide, please. And the main tool really that we used was PDSA. And this was thick and fast throughout the whole project. So the importance of regular meetings, setting your aim, reviewing our aim. We reviewed our aim 1 million times. And once we did that, we would then plan our changes into that process, implement them and set a very clear review date. So it was a continuous process. And then once we'd review it, we'd look at the effectiveness of that change, tweak it if we needed to, without jumping through huge hoops of going through different meetings, but just accepting that didn't work. Let's make a little change and move on and try something else and start again. And actually, we're still doing that today. Next slide, please. So our key learning from going through this process was really that we've gathered lots of new tools and skills in project management and improvement. We've really firmed up our PDSA. We found that as a team, we were quite good at doing this anyway, but it formalised that process for us. So if you get the opportunity to do something like Pride Way, then grab it because it will really help. Data collection when you're trying to make an improvement is absolutely key. So as I say, we were really lucky to have Jane to do that for us. You can't do things on your own, so you've got to use that wider network of expertise. I can see the hand is up, so I need to finish quickly. Having your regular meetings to keep your momentum going, and actually we're all so resilient that we managed to keep going with this during COVID. Next slide, please. So our top tips for everyone: look, it's been a really challenging, unpredictable time to live and work through. Things change overnight in an instant. Success isn't easy to come by, so what you need to do is grab hold of the small successes and accept those and realise that you've made a difference. And don't be disheartened if something doesn't work first time. Just be realistic and flexible, as Jackie said, to change course, and make sure that you consult your patient partners from the outset, because they'll always help you find a way through. Next slide. And just finally, to let you know, for this work, we have been shortlisted for a PENA Award. So for those of you who don't know, that's the Patient Experience National Network Award. And this is in the category of improving cancer patient experience, because this project has improved access to information and support on side effects of treatment, what to expect from treatment, and access to other services like our welfare benefits service. So we're very proud of that. So our next step is to do presentations like this at the finals in September. Thank you.